Шановні гості, шановні журналісти, ми раді вітати вас в Українському кризовому медіа-центрі.
See, and now we're going to talk about the preliminary tests in Ukraine. We are going to have the health in Ogden, United States Agency for USAID, Nitzan, Minister of Health, Giovanna, Barberis, UNICEF representative in Ukraine, and Dorit, Nitzan, World Health Organization representative in Ukraine. Partially, the speakers will speak in English language, so if you need the headphones, please take them at the back of this room. You're welcome to ascend to this podium.
Okay. Good afternoon, everyone. How are you? It's a pleasure to be here in Kiev. It's my second trip here, and I'm glad to see the blue sky and the sunshine. Ukraine is in a very interesting situation right now as relates to polio eradication. Ukraine's immunization program used to be one of the best in the world, and I'm very sad to say now it's among one of the worst. Ukraine went from 90% coverage a decade ago to 14% today. This is one of the lowest coverages in the world, including countries at war and also facing insecurity and economic challenges. There have been no vaccines against any disease available in the country for over a year. No other country in the world is in such a dire situation or shows such disregard for protecting children against childhood diseases. Millions of children in Ukraine are currently vulnerable to vaccine-preventable diseases and are not immunized or only partially immunized. A recent study by UNICEF of never vaccinated children from Africa, South Asia, and the Middle East estimates that 1.7 million children have never received a dose of any vaccine. Astonishingly, the number of Ukraine's un- or under-immunized vulnerable children exceeds that of the world's poorest regions. Ukraine once set an example of putting children first and was proud when the European region was certified polio-free in 2002. In the past, a confirmed case of polio would have been given immediate attention. As a current member of the Certification Commission for Europe, I am deeply concerned about the inadequate response and the implications for the country and the region. On September 1st, the Ministry of Health rightly notified the public about 2 paralyzed children that tested positive for polio, and which was reconfirmed by the CDC in Atlanta. In 2015, Ukraine joins Madagascar, Mali, and South Sudan on the list of polio-free countries with newly confirmed polio cases, requiring the same level of outbreak response with the goal of stopping the virus in its tracks in 4 months. Ukraine is already far behind schedule on its outbreak response. Ukraine, as a signatory to the 1988 World Health Assembly resolution to eradicate polio, the international health regulations, and numerous other international health decisions, has pledged to institute the necessary measures to reduce the spread of disease and maintain a rapid response capacity. The lack of support for Ukraine's brave and competent frontline workers who are caught in the crossfire of false rumors, myths, and rhetoric about the safety of the vaccine undermines confidence in Ukraine's overall health system. The government has asked for and received internal and external verification that the vaccine is safe. It is time to put this controversy to rest and get on with the job of vaccinating children. Ukraine has to do more than aspire to European standards. You have an opportunity to follow the international guidelines and prevent the outbreak of a disease that has seen explosive outbreaks in the past. Most recently in 2010 in Tajikistan, where 460 children were unnecessarily paralyzed by polio because they weren't fully vaccinated. Outbreak response guidelines say that vaccination should have started within 14 days of notification, and that 3 rounds of vaccination campaigns targeting 2 million children from birth to age 5 should take place over the next 3 weeks, acknowledging that older children may be needed if they have not been fully vaccinated. It is now 45 days since the outbreak was notified on August 25th, and not a single child has been vaccinated. Clearly, much more needs to be done. The outbreak response guidelines call for a presidential declaration of a public health emergency. So far, there has been no declaration. And although a plan of action has been drafted, it has not received public endorsement at the highest levels of government needed to mount an effective cross-ministerial whole-of-government response. The identification of an emergency operations manager hasn't begun. Protecting Ukraine's children is more than the responsibility of the Ministry of Health. It is all parts of the government working together on a common goal to protect its children. The international community is calling on the government of Ukraine to fully implement the international outbreak response guidelines. International experience has shown that slow, inadequate response drags outbreaks out and increases the cost and potential for international spread. Poliovirus circulates silently. Only 1 child in 200 shows symptoms of paralysis. The other 199 children don't know that they are spreading the virus, and it could take months or even years until the next paralytic case happens. The 2 cases notified on August 25th are the tip of the iceberg. With several million Ukrainian children unvaccinated against polio since 2008, the risk of an outbreak is high and grows the longer the response is delayed. We are pleased to hear that the children affected by this virus are recovering well, but this doesn't mean that the problem has gone away. In fact, the other 199 children continue to excrete the virus to others, who then excrete it to others, and the cycle continues. Most children don't fully recover from polio. Most paralyzed children live with lifelong disability. There is no cure for polio, only prevention. The only way to stop the virus is by conducting large, well-planned campaigns that will rapidly build population immunity. Decisive action is needed by the highest levels of government. Numerous consultations have already taken place to answer questions on the safety of the vaccine and other doubts. These have now been asked and answered, and resoundingly there is consensus that the reputable scientific and public health community that the vaccines are safe and there should be no further delays. Parents want the opportunity to protect their children. What are the costs to Ukraine of a poor response to this crisis? The European Certification Committee for Polio Eradication, of which I'm a member, is aware of these cases and is charged with reviewing the data. Ukraine will have to prove that there is no virus circulating and has taken the necessary steps to stop the outbreak, or the committee will revoke Ukraine's polio-free status. This has never been done before in the history of polio eradication. Decertifying Ukraine would be a black eye for the country and an indication that the country cannot provide even a minimum standard of disease control and has fallen so far that its immunization coverage is less than most of the poorest countries in the world. Surveillance needs to be redoubled to provide revised, enhanced surveillance to make sure nothing slips through the cracks, and that environmental surveillance protocols are revised to actively search for the virus. Provision of basic health services is a fundamental responsibility of government, and vaccinations are often considered the easiest of services to deliver. A failure to vaccinate is a sure sign that the government is not prioritizing children over other vested interests. Travel advisories are in place for people traveling to Ukraine, and these are reviewed regularly. Stricter measures are possible and could have implications for trade and commerce if not dealt with appropriately. In closing, Transformational change is difficult. Modernizing and reforming the outdated systems that brought Ukraine to the situation will not be easy. Supporting frontline workers to have the tools and protections to do their job is essential. Although a polio outbreak is never a good thing, it exposes weaknesses and vulnerabilities that need to be addressed so that Ukraine can be resilient, respond to future outbreaks, and build confidence in the health sector. This is an opportunity for building a better, healthier future. And thank you for your time.
Thank you very much, Ellyn. I would like to invite to stage Minister Alexander Kvitashvili.
Thank you very much for the opportunity given to me to speak before this very authoritative audience. You just heard how serious all this is and how all of us, we have to treat this outbreak very seriously, because the consequences and implications could be very, very bad. And it's very important for everybody to understand that we are going to start to follow those standards and guidelines which have been already provided the world over. They are operational, and all the vaccines have been delivered to different regions. They are supplied, they have necessary supply for months. We actually provided training so that everybody knew how to respond to the outbreak of the polio in Ukraine. I understand only too well the concern of the international community, because Ukraine is part of the huge European continent. Of course, our incorrect or incomplete response to such a problem is going to become not only the problem of Ukraine, but of the whole continent, which is a very serious challenge. I would like to thank all the international organizations who render assistance to this country. If it were not for the aid on the part of the Canadian government, which through the UNICEF purchased 3.7 million doses of vaccines, we would find ourselves in a just disastrous situation. And this problem in Ukraine has been, a long time, since 2008, as Ellyn mentioned, that when the serious, let's say, anti-vaccination campaign took place, which actually resulted in the situation available today. Absolutely ungrounded, unjustified questions or issues regarding the quality of the vaccine in Ukraine. They have no grounds, and that's why it was delay in our response to the outbreak of the polio. But yesterday we had a meeting with the Prime Minister. During the Cabinet Ministers meeting, he gave a clear instructions, or the presidential letter, and today I already signed the order regarding the plan of actions, and proceeding from the fact that we already supplied different regions to different regions, we can issue the instructions or guidelines to use those vaccines. This is a proof that Ukraine very seriously tackles or treats this problem, and we are going to do everything possible to eradicate, or just to make impossible any repetition of this situation in the future. I would like to say a few words in English, just not to lose anything in translation, so that our partners know what we do and how we do that.
I'll say a few words, not to get lost in translation, because it's important to know that the steps that we're taking. I'm eternally thankful to the Canadian government, and I thank you, Ambassador, for your personal involvement in helping Ukraine, because if we didn't have the stash, that I don't even know what would have done or what we could have done. We've had much of a debate about vaccination. Unfortunately, Ukraine still is a country where vaccination is a debatable issue. And I follow some posts on Facebook and other social media, and it's really staggering what people write there. And unfortunately, sometimes those are health officials that do that, and doctors that practice medicine. However, given the sensitivity of the issue that historically has been present in Ukraine since 2008, we've come to the point of planning everything meticulously, very clearly and very thoroughly to make sure that the mistakes are not made and the campaign is not undermined. And last night we have issued a decree based on which we can start moving. And today I already signed the decree, and everything will be started, and you will see the progress, how fast we can move and how well we can do that. We're still missing 6.5 million or 6.3 million doses. We have discussed that today at a meeting with the European partners, and hopefully we can find a way to bring in the necessary quantities to the country before the end of the year, so we can cover every possible case scenario that, every child that needs to be vaccinated, revaccinated, or go back. We have to go back 8 years into vaccination. So I would really like to thank UNICEF and WHO, who have shown a clear leadership in helping the Ministry of Health to spearhead this process. I would like personally to thank Giovanna and Dorit, who've been great supporters. And I really hope that with the backing of the international community, with the understanding of the society and the media here, we can push polio on the highest agenda possible and deal with the outbreak in a very professional and effective and efficient way. So thank you all for your support, and I hope that this, from now on, we'll only have positive news regarding the campaign. Starting this. Thank you.
Thank you very much, Mr. Minister. And I would like to invite on stage, as said by the Minister, the great supporters, Dr. Dorit Nitzan, representative of the WHO in Ukraine, and Ms. Giovanna Barberis, head of UNICEF.
Thank you. Thank you, friends, colleagues, Minister, His Excellency, Your Excellency, Ambassador, USAID, friends and colleagues from the US Embassy, as well as Sister Giovanna and UNICEF and all of you here. I really want to thank you. And we are feeling now encouraged after 6 weeks delay and many, many days of fight. We are feeling more encouraged, and I thank you, Ellyn, for your words. You really expressed everything we wanted to share. We are hoping now that, Minister, with your leadership, your clear leadership, with the support of the Prime Minister and the President, Cabinet of Ministers, and from what we hear from the health professionals that are contacting us and the parents, there are many, many good professionals in the country, those who know what they're talking about. We want them to have the voice, to be able to voice it everywhere, also in the social media. We hear those who are against, but most of the people, the great professionals, are there, and we are working with them and proud of them. Many of the nurses and the doctors are ready to act. They're asking for vaccines. Many of the parents are ready to get their children. They are eager to do it, and I'm sure that you will lead this movement for a healthier Ukraine. Yes, you said it, and it was said also by Ellyn. The polio outbreak is just one of the signs and symptoms of a disease health system. Unfortunately, the minister got here this health system and is working hard with the team to reform it. And polio, one of the diseases that is really, we can prevent it. Many other things we cannot. You need to work with the health system thoroughly. But polio, with 2 drops, every 2 drops are so meaningful. Let's give those 2 drops the time, many times as we need, to cure, to get rid of this virus, this enemy among us. We are always thinking about other enemies. We have little enemy that is very, very dangerous. So here we know that many people are around the world, not in Ukraine anymore, I believe, but are questioning vaccines. This is a luxury to question vaccines. It's a luxury that came to us through our life, because many of us not me, but some of you, were born after the polio outbreaks in your countries. So many of the young parents today, they don't know what it means. I can tell you, as a pediatrician, as a mother, this is terrible. You don't want to see it. Let's get rid of this enemy, treat the health system together, and join hands for better, healthier Ukraine. Every 2 drops count. Thank you.
Thank you very much. I'm too short for this. Good afternoon to everybody, and thank you very much for this opportunity. Thank you very much, Minister, for being here today with this good news. Thank you, Ambassador, for always your support, USAID. Ellyn, thank you very, very much indeed. An excellent, comprehensive presentation and introduction to all the problems that we are actually facing today. And of course, thank you to WHO, with whom we are really working always very closely, supporting the Ministry of Health. Just a lot has been already said. What I would like just to say is that indeed, in spite of the mistrust, in spite of what the minister was saying, vaccination is still, in Ukraine a debatable, issue. Parents are really, the majority of parents in this country are really eager to vaccinate their children and to protect, the health of their children. We are receiving, in our office, calls almost every day by parents asking, what is it that we can do? Where are the vaccines? We want to vaccinate our children. So, indeed, we will have quite a number of challenges. There is no doubt, but I think there is a positive force, a positive attitude that has grown, over the years. And according to the survey that has been done not long ago, 70% actually of parents do start acknowledging, the value of vaccination, and this is, of course, extremely encouraging. So, I would like to say that we are extremely satisfied that we can support finally, the implementation of the response plan. The vaccines are there, are available. The response plan has been thoroughly developed. So I'm sure that under the leadership of the Minister of Health, the first round of vaccination can effectively start and can be also very closely be monitored. I think that the challenge will be really to try to understand as much as possible what is happening on the ground and to which extent, the campaign or the round will be really covering the majority of children. Thank you very much.
Thank you very much to Giovanna. I would like to invite all the speakers up on stage, and dear journalists, if you have questions, this is the high time for them. Шановні журналісти, ми відкриваємо серію запитань-відповідей. Якщо є запитання, прошу не забувати.
So, dear journalists, if you have any questions, please do not forget to introduce yourself and say who you address your question to. Interfax Ukraine, Anna Levchenko. I have a question to Mr. Minister of Health. On Wednesday, during the session of Verkhovna Rada dedicated to the healthcare country, they said that to start this vaccination campaign, we had the resolution of having the ministers to be signed. Yes, yesterday we actually finalized this resolution, which will require the Minister of Healthcare to take all necessary steps to vaccinate children against polio. And, so everything is ready, and based on this document, today I already signed the order for our ministry, which will give green light to take care of vaccination. Thank you. Next question. Veronika Gavriluk, Radio Vesti. I have a question to the experts from UNICEF and WHO. What is the level of immunization in Ukraine today? You said that one of the lowest the world over, yeah? And how fast it changes. So, for example, we start this vaccination now. How is this level is going to change in the future? Thank you.
I can say what I know, but I'm not an expert, but I do know that for 2015, only 15% of children were vaccinated against polio. And overall, right? In overall, only 50% of children are fully immunized, but I'm sure you can add something.
Yeah, actually, what Giovanna just said, in the year before, we, from all the information we had, it was under 40% in 2014, and in 2015, it's between 14 to 17%. Some region, it's even as low as 10 to 11%. This is record low. It's unbelievable. We just compared today the coverage in countries that are Ebola strict, those that many Ebola patients, and we found out that on average they have between 40 to 60% coverage, which is extremely low. So you can imagine where we are here.
Я просто добавлю для информации, это не из-за того, что...
I can add to this information, not because we did not have the polio or vaccine against polio. For the routine vaccination, we've had and still have the necessary vaccine. So the lack of vaccination, not because we did not have it. What was donated by the Canadian government to us, those are the reserves to vaccinate all those who we have to vaccinate now, and those who lost their chance to be vaccinated, so to say, since 2008. Again, this is the task for the whole system of the healthcare, and the parents have to start to realize the importance of this thing. The world over, the issue of vaccination is never discussed nowhere. And I may say what Giovanna or Dorit what mentioned a few minutes ago. Yes, we are acquainted with information. In Liberia, 40% people are vaccinated, 3 times more than in Ukraine. What Ellyn mentioned, that we are among these 3 countries where the polio has this outbreak of polio, Southern Sudan, Kazakhstan, and we, And this is catastrophe. And I would like to emphasize that I'd like you to understand this is not the task only for our ministry, the task for the whole society. This is something important to everyone, for the parents. I was really amazed when I saw the number of the quantity of the vaccines used in this country, not only against polio, different kind of vaccines, the lowest in this country. For example, the BCG vaccine, they never use it in the United States or Canada, but we really have to provide a very serious information campaign, not PR campaign, but information campaign. I understand we have something in place now, in the pipeline at least. We have to launch it so that the people can take the decision proceeding from the correct, right information, which we have to provide to them, because the role of the mass media is huge. That's why we address you with our request to help us and to convey the proper messages, so that we never have to deal with such an issue or problem in Ukraine, never again, because such situation is not available in any country of the world now. Clarification, and there's to Ellyn. Ellyn was quite emotionally saying about isolation in Ukraine due to the outbreak of polio, and what is being recommended, or was recommended to the tourists not to come here. So can you please be more specific about those restrictions which are in the pipeline or already, already adopted? If they're going to be adopted, which exactly restrictions?
Yes, it's an excellent question. So a number of countries have voluntarily asked for proof of vaccination before people coming from Ukraine can travel, and have also recommended that their own citizens be vaccinated against polio before coming here. This is not unprecedented. A number of countries have travel restrictions in place. For example, India requires proof of vaccination for people coming from Afghanistan or Pakistan. Saudi Arabia has legislation in place requiring proof of vaccination for anybody traveling from the Hajj to Mecca. The International Health Regulation Committee that looks at these issues looks at it quarterly and makes at first a soft recommendation that people traveling to a polio-affected country ought to be vaccinated. But if the necessary measures aren't taken, they can review that every 3 months and make the request even more serious. So to actually require proof of vaccination, a yellow card, before leaving the country, if it gets more serious than that, they can ask recipient countries to have proof of vaccination before people arrive. Individual countries have the right to request proof of vaccination when applying for a visa. Where countries fall along those lines really depends on your response now. How serious is this? How is it going to be perceived as a threat in the region and in other countries? And how seriously would the International Health Regulation Committee that looks at this take it? You have an opportunity now to avoid this. In other places where they've shut borders or shut off commerce and trade because of travel restrictions, it's caused huge economic losses. I think there are many good reasons to vaccinate, not only protecting the children, but to think about these other potential consequences in the future. Thank you.
Can I add something? Yeah. Just to add to this aspect, polio falls under the international health regulations, and when the declaration of the outbreak will become to this level, hopefully never, then the impact is going to go beyond the impact on the health of the children, and this is something that we will do our best to avoid.
Я тоже добавлю, потому что вопрос был очень серьезный. То, что рассказала Ellyn.
Also, I would like to echo what Ellyn said. What's going to happen if we just sit on our hands and do nothing, you know? This is something tragic and scary. This is a real situation. It is something apocalyptic, you know, but this is really true. We cannot but respond to that very fast and very correctly. And our preparedness to vaccinate our children, this will be a signal sent from Ukraine to other countries that we respond a proper way, and we take care of, we actually implement whatever we can do. And, you know, I visited Africa well, yeah, you know, before going to Africa, you know, nobody made me or forced me to do that, but I myself decided to have some vaccination, you know, before coming here. So everything pretty much depends upon how we're going to behave. I have two short questions to Mr. Minister. So please clarify what was the reason of delay for 6 weeks before the vaccination campaign started. Number two, after today's decision, when this campaign is going to be launched, actually. I can give you a quick answer for the second question. We are prepared to launch this. Regarding the reasons for the delay, this is a long story, you know, and some of my colleagues here already mentioned that there were some ungrounded issues associated with the storage of the different batches of vaccine which were imported to country in May of this year. The WHO and UNICEF said there were no problems, but this caused the delay. I understand that the international community is not happy about that, but honestly speaking, what I think, that the batch which arrived later, which is already been sent or disseminated, spread all over the regions, I believe we did the right thing, so maybe with some delay, but not to torpedo the whole system of vaccination, generally speaking. Maybe this is somebody's interest or some groupings are interested in that. But we are going to close this specific problem, so no questions remain, you know. But we have to also to understand that the scale of vaccination, which we have to start, they are huge. I mean, the scale of this, it's not just to bring the vaccine and give instruction to the doctors, so let's say, start this, you know, proceeding from the percentage of vaccination of children in this country. We had to take care of the mass-scale trainings for those who are going to provide this vaccination. This is not an easy thing to do. We have to provide all the guidelines so that everybody observes all the necessary protocols and all the rest, you know. Today, well, I didn't hear the question. Well, they already are issued the instructions and the guidelines what to do, what to start with. So we do not see any problems any longer. We are going to visit the different districts, regions, and watch and monitor. I personally am going to monitor, supervise what is being done there. So we'll try to do everything possible now. Another clarification, continuation of this topic. Are there any statistics regarding the percentage of volunteer rejection of vaccination? You said that there was some campaign this issue. The problem is not that we did not elect the vaccination, but when the parents said that they did not need that. Are there any figures regarding those voluntary no to vaccinations? You know, it would be logical. So let's say if you have 14% of those who were vaccinated, logical to understand that 86% didn't want to do that, you know. Evgeny Verkhorenko, the weekly Avtika. Mr. Minister, my question is addressed to you. What do you plan to do with the repeatedly frozen vaccine APV, whatever it is, you know? The minister is going to stick to the schedule of vaccination. This is not an issue, but we really would like to those justified or not so justified, grounded, non-grounded issues we had to leave those. I'm talking about the quality of the vaccine. We are going to retest those vaccines in the reference laboratories, some samples, I mean. Samples, yeah. Samples testing, and we are going to remove this issue within 2 or 3 weeks. I mean, to take care of this issue. Once again, I would like to emphasize that the question which was raised based on the publications, which is absolutely, I cannot understand that what was put on the web page, which shouldn't be a grounds to raise that issue. But, you know, this is the reality we are living through. We would like everybody to understand that there are no problems with the quality of vaccines. Thank you. We have the last question. Good, Ellyn Bokat, 1+1 TV channel. So, who is responsible for the procurement? Oh, I mean, for the delay in the procurement. Procurement of what? So, who is responsible for the delay in procurement? I understand the vaccines. What are you talking about? We have 3.7 million doses. Were they purchased in due time or with some delay? You know, okay, we have a scheduled or planned, so to say, vaccination regarding any kind of vaccine. And there are extra scheduled vaccination, unscheduled, and for that we need something, for example, some kind of outbreak or whatever else. But since in Ukraine the children were not vaccinated against polio since 2008, that's why last year we reached the agreement with the Canadian government, and they donated to us a huge number of doses of vaccine so that we could revaccinate those without waiting or expecting an outbreak. Outbreak was, it happened, it was logical. As for the scheduled number of doses of vaccine, it's going on according to the plan, you know. Yesterday, the cabinet meeting, we approved the list of those medications we are talking about 2.5 billion hryvnia, which are going to spend and purchase with the UNICEF help, WHO and PROON. UN, I mean, and this is a big step forward towards the necessary procurement of necessary dose of vaccines, and absolutely positive that proceeding from the fact what the difficult road we had to cover, starting from the adoption of the law, making amendments in the different resolutions and our agreements with international organizations. Next year, this process could start much earlier than this year because we already covered all those paths, you know, ways, whatever else, and we know what to do, how to do, and how to do it much better than it was the case 6 months ago. So this is also good news. So at this supposed to note, I would like to say thank you to you. Thank you, Mr. Minister. Thanks to our esteemed guests for the presentation. We hope that we are going to win over in this fight against this epidemic. And thank you, and see you again.